Hello, today I'm going to talk about health disparities. To define health disparities, I could basically say it would be the health outcome of people from different backgrounds or vic people with different criterias. Different background, we could definitely say different financial background, social, racial, or even educational backgrounds. So health disparities is basically let's say from a financial point of view, somebody with more money and somebody with less money. So it would basically be the difference between their health or their health outcome, pretty much. As far as how it affects my community, I would say race is a big thing because sometimes people from my community sometimes they experience racism or discrimination, which makes them less likely to seek medical attention when they need it. But yeah, I would say that's one of the biggest things. A few of the prompts that I wanted to point out is the first one would be how does education impact healthcare and healthcare access? So when it comes to healthcare access, I would say education is a big thing because it helps you when it comes to knowing what's available to you, what are your options. Healthcare basically with the more educated you are, basically based on studies, the more likely you are to engage, the less likely you are to engage in certain behaviors that would in turn be bad for your health. Another prompt I would say captivated my attention was do these disparities affect health promotion and prevention care? Health promotion, I would say yes, it does. I mean, they do. Let's say looking at it from somebody from, let's say, from two people from different financial backgrounds. So let's say somebody has more money, the other one doesn't. So somebody with more money would have access to more resources, therefore be aware of more preventive cares. So they would have access to better healthcare providers, basically who would in turn tell them like what's available to them, what are their options, or if they want to prevent certain things. While somebody with like let's say less financial opportunities, the range is somewhat limited, as they often rely on insurance, which is sometimes not not the best when it comes to like healthcare. So most of the times the physicians they cover, they do not have as much resources as the ones that cater to people with better financial situations. Another one that captivated my attention was what potential solution could assist in reducing healthcare disparities in your community. I would say one thing that could make health disparities a little bit better would be to decrease the cost of healthcare because healthcare is like really expensive, and having to pay for it out of pocket sometimes make people it makes people somewhat reluctant when it comes to like acquiring or using healthcare services available to them. So I would say lowering the prices would definitely help as far as decreasing the healthcare disparities. And the last one that captivated my attention was how could a self-reflection performed in this course make you a more empathetic future healthcare professional? I would say self-reflection basically would allow me to be more compassionate and more understanding of certain people, and to show them that it's so things are different for different people, and that regardless of their backgrounds, that you're open to provide them with the best resources and to try to help them in order to like better their health. Overall, I would say health disparities is something that people encounter in everyday life. I mean, although we do have a lot of work to do, but I would definitely say that over the years it has gotten like a lot better. So although we do have a long way to go, but I would say how it was back in the day, it's a lot different than how it is now as far as preventive care and access to health care. Thank you.